Medical field is transforming with several ways of treatments. However, homeopathy maintains its importance and effectiveness. Unique features like targeting the root cause of disease with providing complete cure for the patient is something that has been the reason of homeopathy's popularity even today. Due to increasing awareness, a large number of patients are opting for homeopathy, from the common man to the elite class. Experts of homeopathy, on the basis of their research and meticulous and sincere efforts to help patients get remedy, are not only finding solutions for several serious chronic diseases and helping patients live a normal and healthy life, but also creating large-scale public awareness about this treatment. Dr. Vijay Kumar Mane, one of the most reputed homeopathy practitioners of the world and the founder and CEO of modern homeopathy, has been practicing for more than 2 decades and has been successfully curing numerous patients with serious and chronic diseases through his extensive research and innovative treatment methods. He is also helping patients to regain self-confidence and live a happy and healthy life. Dr. Vijay Kumar Mane started his medical career as a lecturer and did extensive researches on traditional treatment therapy and invented simple curative line of treatment named modern homeopathy for several incurable diseases and gave relief to numerous patients. His journey began around 1998 from Kolhapur and steadily it spread to other parts of Maharashtra as well. Soon, patients from other states of India as well as patients from around the world started visiting him and consulting him for his treatment. No doubt, his innovative ways soon proved beneficiary for the patients. Modern homeopathy's curative line of treatment has come into existence through thorough research, vast experience, and a huge database of successful case histories of patients of Dr. Vijay Kumar Mane. His continuous efforts to excel and steadfast research for further innovations, searching solutions for the patients with the most complicated symptoms have been the reason for his success. Dr. Mane is continuously working towards inventing new, effective treatments and innovative medicines of various serious and pathologically advanced diseases like cancer, kidney failure, liver cirrhosis, diabetes, asthma, arthritis, and other incurable diseases. Modern homeopathy is also designed to manufacture and produce medicines formulated and innovated by Dr. Mane. Medicines which are found both in liquid form and in globules and are easily consumable and highly result-oriented.
Hello, I'm Dr. Mrunmayee and welcome to your favorite health series, Healthy Era with Modern Homeopathy. Today, we are going to talk about liver cirrhosis. Liver cirrhosis is a serious disease with serious complications including liver cancer and even death. So, when someone is diagnosed with liver cirrhosis, what he or she should do? They should just cry or they should lose hope? Do we have some better options? Today, we are going to talk about the role of modern homeopathy treatment in treating and curing liver cirrhosis. I am glad today we have with us CEO of Modern Homeopathy, Dr. Vijay Kumar Mane. Hello sir and welcome to the show.
Hello. Hi everyone.
So as we know that liver cirrhosis is a serious disease, but what are the complications of this disease?
As we know, liver cirrhosis is a very much serious disease. It is also called as end stage liver disease.
Oh.
That means after that there is no treatment in conventional way of treatment. The complications of liver cirrhosis include ascites, depletion of hemoglobin and platelets that can cause bruising of skin, and in later stages bleeding through major orifices of the body, through mouth, through nose and through anus, or bleeding in stool. That are the major complications. Other complications include jaundice. If jaundice continues, then major complication is death due to jaundice.
So any other complications of cirrhosis?
Yes. Cirrhosis also have in a few more complications like ascites and pleural effusion.
Okay.
Then the bile get hardened and thickened, So, formation of gallstones, then insulin dependent and non-insulin dependent diabetes mellitus, that is type 2 diabetes. These are other complications. One more complication is also there, splenomegaly, enlargement of spleen.
So, diabetes can also caused by liver cirrhosis.
By liver cirrhosis, and also liver cirrhosis can be caused by diabetes.
Okay.
It is vice versa.
Vice versa, okay. And what effect of alcohol consumption on liver cirrhosis?
Alcohol consumption is the major cause of liver cirrhosis. Consumption 3 ounces a day involves drinking 6 cans of beer, 5 glasses of wine, 6 shots of liquor. About half the men who drink more than 8 ounces of alcohol a day for 20 years can develop liver cirrhosis.
Okay.
Generally, the more and the longer people drink, the greater their risk of alcoholic liver disease, that is liver cirrhosis. The alcohol in the blood starts affecting the heart and brain also, which is how people becomes intoxicated. Chronic alcohol abuse causes destruction of liver cells, which results in scarring of the liver and formation of liver cirrhosis.
Okay.
So, alcoholic liver disease is the major cause of liver cirrhosis in India.
So, what are the other causes other than alcohol?
Other causes other than alcohol are viral hepatitis, that includes viruses like hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E, cryptomegalovirus. Herpes simplex virus also causes liver cirrhosis. Few other viruses also there. Then few drugs like NSAIDs, non-steroidal anti-inflammatory drug, that would be a major cause of liver cirrhosis in India, because NSAIDs are available over the counter.
Yes.
Then drugs like methotrexate and a few anti-tuberculous drugs also causes liver cirrhosis. Then primary sclerosing biliary disease is also a major causative factor in, especially in children.
Okay.
These are the other causative factors of liver cirrhosis.
And what are the signs and symptoms? How can we know that this is liver cirrhosis?
There are vague signs and symptoms like loss of appetite, nausea, vomiting, itching of the body, white discoloration of the body. When the cirrhosis develops, that means 80 to 90% liver get deranged or affected, then the more serious signs and symptoms develops. The signs could be caput medusae, that is arterial sign of skin.
Okay.
Arterioles enlarges and the caput medusae sign seen. Then itching all over the body when jaundice develops due to liver cirrhosis. Then swelling of arms and legs.
Okay.
And there will be pitting type of edema, that edema pits on pressure. Then ascites develops in later stages. Ascites means formation of water inside the abdominal cavity, and pleural effusion, that means formation of water inside lungs. These are the major complications and symptoms of liver cirrhosis. Then black discoloration all over the body in later stages of liver cirrhosis.
All over the body?
These are the signs and symptoms of liver cirrhosis.
Okay.
Sometimes bleeding from mouth and bleeding in stools.
So, what investigations do we need to do to diagnose this?
Investigations mainly include few blood investigations and few imaging investigations. In the blood investigations, we can do CBC. In CBC, hemoglobin seems to be depleted and platelet also depleted. LFTs are also deranged. Bilirubin sometimes is very high. SGOT and SGPT deranged, high or normal. Alkaline phosphatase may get very high levels. Then few other investigations are required in blood investigations. When we are suspicious about that particular patient may suffer from liver cirrhosis due to some autoimmune diseases like SLE, then we can do ASMA, SMA. That test indicates towards autoimmune liver cirrhosis or SLE. Sonography of abdomen and pelvis, it will show cirrhosed liver and nodular formation in liver, or enlargement or shrunken liver, that may show shrunken liver also. Then if we suspect cancer due to liver cirrhosis, then we can do MRI of liver, MR elastography of liver, sonographic elastography of liver, CT scan of liver or whole abdomen. These are other imaging investigations.
So basically in liver cirrhosis, we have many investigations and we have known many causes of liver cirrhosis. Now we'll go to the treatment of liver cirrhosis, what treatment we can have. We'll talk about this right after the break. Welcome back after the break. You're watching your favorite health series, Healthy Era with Modern Homeopathy. Today we are talking about liver cirrhosis. There is a patient named Mansingh Sawant who was diagnosed with liver cirrhosis. He opted the treatment of modern homeopathy. Let's see his reports and what he has to say about it.
67-year-old Mansingh Sawant of Pune. In June 2017, all of a sudden, Mansingh started complaining of giddiness and hematemesis.
जे कसं मी नेहमीप्रमाणे रुटीन वर्क करून घरी आलो असताना एकदम अशी मला चक्कर आली आणि रक्ताची उलटी झाली. त्या रक्ताच्या उलटीमध्ये जवळजवळ 1-1.5 लिटर रक्त पडलं.
A well-known doctor advised him to get admitted in a hospital.
फॅमिली डॉक्टरकडे गेलो आणि त्यांनी आम्ही एक नामांकित हॉस्पिटलमध्ये ॲडमिट व्हायला सांगितलं. नंतर तिथंसुद्धा OPDमध्ये बसलो असताना मला एक बराच वेळ बसावं लागलं आणि तिथं चक्कर आली आणि तिथंही रक्ताची उलटी झाली. तीसुद्धा जवळजवळ 1 लिटरभर रक्त तिथं पडलं. नंतर तिथल्या डॉक्टरने धावाधाव करून मला ICUमध्ये नेलं आणि तिथे औषधोपचार सुरू केले.
His endoscopy and USG reports showed 60 to 70% liver damage. He complained of loss of appetite and abdominal pain. He required repeated endoscopy banding according to report 2.
पहिल्या इंडोस्कोपीमध्ये म्हणजे ज्यावेळी मी ॲडमिट झालो, पहिली इंडोस्कोपी झाल्यानंतर त्यांनी सांगितलं, निदान असं केलं की तुमचं 60 ते 70% लिव्हर डॅमेज झालेलं आहे आणि याच्यासाठी तुम्हाला दर 15 दिवसांनी इंडोस्कोपी करून घ्यावी लागेल. म्हणजे त्या लिव्हरची कंडिशन काय आहे हे पाहण्यासाठी दर 15 दिवसांनी इंडोस्कोपी करावी लागेल. त्यावेळी इंडोस्कोपी करताना इतका त्रास व्हायचा की भयंकर तो सहनच व्हायचा नाही.
In July 2017, the report showed platelets 67,000 and hemoglobin dropped to 8.7. In September 2018, he started modern homeopathic curative line of treatment.
डॉक्टर विजयकुमार माने यांचं धनकवडीच्या क्लिनिकमध्ये आम्ही त्यांना भेटायला गेलो. भेटल्यानंतर त्यांना सगळे मागचे तो रिपोर्ट दाखवले. इवन लिव्हर सिरॉसिस डिटेक्ट व्हायच्या अगोदरचे पण रिपोर्ट दाखवले आणि त्यांनी ते रिपोर्ट पाहून सांगितलं की तुम्ही अगदी योग्य वेळेत तिथं आलात. कारण लोक अगदी शेवटच्या स्टेजला माझ्याकडे येतात, परंतु आम्ही जे पेपर चालवते ना ती योग्य वेळ होती आणि त्यांनी सांगितलं की हा आजार तुमचा मी पूर्णपणे बरा करू शकतो.
And within a little over a week's time, he started showing improvement. The doctors of modern homeopathic curative treatment were convinced that they could cure Mansingh, and this resulted in a tremendous boost of self-confidence in Mansingh. With the treatment, his appetite started increasing gradually.
त्यांनी औषधं दिली. औषध दिल्यानंतर एकदम 2-3 दिवसात आम्हाला फरक वाटू लागला की आम्हाला फ्रेश एकदम वाटायला लागलं.
He started feeling better and slowly his previous complaints reduced.
शुगर नॉर्मल झाली, थायरॉईडचे पण प्रमाण कमी झालं, फ्रेशनेसपणाचा भरपूर आला.
The November 2019 report showed that his hemoglobin had increased to 14.5 and platelets to 96,000. According to FibroScan report, his condition improved. Now he doesn't require hospitalization anymore.
डॉक्टर विजयकुमार माने यांनी दिलेले औषध घेण्याची जी पद्धत आहे ती अत्यंत सोपी आहे. ते फक्त घरच्या घरी राहून आणि कुठल्याही आर्थिक किंवा मानसिक त्रास न होता ते औषधं घरच्या घरी राहून घेता येतात.
And the modern curative homeopathic treatment has now given him a new lease of life and is now living a very healthy and normal life.
Mr. Mansingh Sawant, who was advised liver transplant, but he opted for modern homeopathy, and today he's completely out of the disease, he's completely cured. We would like to know more about this case. We'll talk about it right after the break. Welcome back after the break. You're watching your favorite health series, Healthy Era with Modern Homeopathy. In last segment, we saw experience of Mr. Mansingh Sawant, and now we want to go in depth of that case. So, sir, we saw the results, we saw the reports also, and we would like to know more about this case.
Patient saw the program of modern homeopathy on TV and took appointment. He was advised to take medicines from modern homeopathy. As history narrated by patient, he had relief from taking medicines from second day.
Okay.
In 2-3 months, his complaints reduced very much. Then was advised to do repeat investigations, which came to be within normal limits after few months.
After
Yes.
So, here in India, we have trend that whenever there are some complications and all the people who can afford to go out of the country, they prefer to go in Western countries and they think that there is treatment is advanced treatment, they will get some advanced treatment over there.
Yes.
So, what is your opinion about it?
My opinion is that there is no need to go abroad, as the treatment for liver cirrhosis which is available in India, that is symptomatic treatment and liver transplant, the same treatment is available outside of India, and we know that transplant is very much costly and success rate of transplant is very much low or very less success rate we have seen. And we all know that conventional treatment in India or outside India, one and the same, and it is only symptomatic treatment. Under modern homeopathy, the treatment is curative line of treatment. We can treat the patient, not the disease. And as our treatment is depend on immunity enhancing, we treat the basic causative factor of the disease, and so we cure the liver cirrhosis. So there is no need of liver transplant or conventional line of treatment.
Okay, sir, I have also heard that for modern homeopathy, there are patients who are coming from outside Maharashtra and outside India also.
Yes.
So, we would like to
we
know
have
more.
patients outside Maharashtra in many states of India, and abroad we have patients from USA, UK, Finland, Norway, in European countries like Germany, Asian countries like Thailand, some Arab countries, we have patients.
So, that is really great because it is just reverse flow we are doing. So, basically sir, when we say results of modern homeopathy, how exactly it acts?
We treat the patient, not the disease. So, our immune system get modulation under the modern homeopathic treatment, and our immunity and our physique can heal itself with the help of modern homeopathic medications.
Okay.
So, the pathological changes get reversed after modern homeopathic treatment, as we have seen in this liver cirrhosis case.
So, as we have seen, you must have seen in your practice that there are many patients who go for other kind of treatments, and they, after developing complications, they will come to modern homeopathy.
Yes.
And there are some patients who directly comes to modern homeopathy. So, definitely there must be difference in results in these two types of patients.
Not much difference in results, that we have similar results in when patient comes early without any treatment in liver cirrhosis, or patient comes later after full blown picture of liver cirrhosis. As you know, we have treated patients, very serious kind of patients, when allopathy doctor told the patient that there is no further treatment or you can go for transplant immediately, or when patient develops coma, or patient develops ascites, or patient develops very severe jaundice, when the bilirubin, we have treated patients when bilirubin was 50.
Oh.
And the treatment is totally home based, there is no need of hospitalization also. So, the results are one and the same, but the time for cure is differs.
But when patient comes directly to modern homeopathy, he saves a lot of money also.
Yes.
And of course, costing part is important, and I would like you to speak on it.
In conventional line of treatment, when patient is in complication, he or she needs hospitalization. Usually hospitalization include admission in ICU or ICCU. So, the per day cost is very much higher. Second thing is that other optional treatment is liver transplant. The cost of liver transplant is much higher, it will be it will range from 25 lakhs to 50 lakhs for transplant. And if transplant is successful, then the cost of immunosuppressant drugs would be near about 1 lakh per month. So it is quite higher and it is not affordable to common patients. And in comparison with that conventional line of treatment, our treatment is totally home based, OPD basis treatment. So most of the time no need of hospitalization, no need of liver transplant, as you have seen.
Yeah.
So the cost will be very much less.
So basically less efforts, less money and excellent results is modern homeopathy.
Yes, with assurance of results.
Yes, definitely sir, and thank you so much for being here today, for sharing your valuable experience to all our audience. Thank you so much.
Thank you very much.
And if you have any queries about liver cirrhosis, or you want to know more about modern homeopathy, you want to know more about the treatment given in modern homeopathy, then definitely you can call anytime on the numbers which are displayed on your screen. So here we take a leave for today. Goodbye and take care.
Our address, Modern Homeopathy Research and Treatment Center, E Ward near Gita Temple, Kawalanaka, Kolhapur 416003. For counseling and guidance, contact at our centers below: Kolhapur, Dadar, Kalwa, Thane, Dhankawadi, Pune, Pimpri, Chinswar, Nashik, Aurangabad, Nagpur, Solapur, Goa, Madgaon and Mapsa, Karnataka, Bangalore and Hubli, Telangana, Hyderabad. For counseling and guidance, give missed call at 70388-33881. You can also contact us on 9730339009 or at 9372728009. Our toll-free number is 1800-121-8009. Our website www.modernhomeopathy.com. You can also email us at contact@modernhomeopathy.com.